still some people are still here.
Okay. My microphone is still off.
No.
No? Okay.
Maybe we start, it's going to attract the people that are in the back.
Okay.
Yeah. Okay, let's go.
Okay. Welcome, everybody. On behalf of CSS and EPFL Innovation Park, I would like to welcome you to this year's Demo Day and Conference of the Future of Health Grant. We're excited to be here tonight. My name is Jan-Niklas Kramer. I am a member of the core team of the Future of Health Grant, and I will be one of your hosts tonight, guiding you through the event. And with me is my colleague and co-host, Johannes.
Thank you, Jan-Niklas. Thank you, everybody, for joining this event. My name is Johannes Brie. I'm from EPFL Innovation Park, the program manager of the Future of Health Grant. And we are excited to have you all today in person at the Rolex Learning Center, Lausanne. So today we'll talk about the subject of preventive medicine as a way of improving the quality of life of the patients. So we call it sometimes Medicine 3.0. So maybe, Jan-Niklas, you can tell me more about it. What is Medicine 3.0?
Yes, so as you might have seen, we have chosen a topic today, which is called Healthier Tomorrow. And we will elaborate a little bit what we mean. It points to the transition of healthcare systems moving to a more preventive approach of medicine that is what we call Medicine 3.0. We did not invent this concept of Medicine 3.0. It has been invented by experts, and there have been written books about it. But we will briefly summarize the concept of Medicine 3.0, and of course, if we want to ask the question, what is Medicine 3.0, we will need to explain what is Medicine 1.0 and 2.0. So with Medicine 1.0, we mean the old medicine of Middle Ages that have no foundation in science. These were all sorts of crazy ideas, and luckily, this is no longer the medicine that we know today. Today, we are living in Medicine 2.0. It's a science and evidence-based medicine, and it has brought breakthrough technologies such as vaccine and antibiotics that have dramatically increased our lifespan and the quality of life. In fact, in the transition from Medicine 1.0 to 2.0, the life expectancy here in Europe has doubled from 40 years to roughly 80 years today. This great increase in life expectancy is due to the fact that the tools of Medicine 2.0 have been able to address the main causes of morbidity and mortality of the 19th century, which are acute diseases and infections. However, Medicine 2.0 has one problem. It is not suited well to tackle the challenges, the morbidity and mortality of today. The main drivers of morbidity and mortality today are chronic diseases, so-called non-communicable diseases, such as diabetes or heart disease. And these diseases require a different approach. Medicine 2.0 is based on the assumption that you start treatment once you detect symptoms and can diagnose patients. And this does not work well with chronic diseases. Chronic diseases need Medicine 3.0, a preventive approach that relies heavily on absurdly early detection of symptoms and detecting the onsets of diseases, and then combating them with highly personalized interventions. We hope that with these highly personalized approaches, we can delay or even prevent the onset of chronic diseases and prolong life without disease. To do that, of course, we need great amounts of data to make that happen. We are not there yet with Medicine 3.0. We are still at the beginning of the transition to Medicine 3.0, and there are many important questions that need to be answered, such as when will we arrive in Medicine 3.0, what will it take to get there, and are we ready in Switzerland? We want to use this event as a platform to discuss and to discover together these questions and possible answers. To do that, we have invited renowned experts on the topic. And Johannes, why don't you tell us what we can expect in the next hours?
Thank you, Jan-Niklas. Indeed, that's a good intro of what we'll be talking about today during this event. So we'll start with an opening words from the two founding partners of the Future of Health grant, which are EPFL Innovation Park and CSS Insurance. Then we'll focus on the topic for tonight, prevention in the new cure, Medicine 3.0, with a top-down agenda. We'll start with two keynotes. We'll take the example from initiatives of America's leading healthcare organization, Kaiser Permanente. And then we'll follow with the keynote of Professor Olga Fleisch, who will talk about prevention and how it plays a comparatively small role today and what we can do about it. Then we'll zoom in with a panel discussion about the situation here in Switzerland. And you will hear the story of a successful startup in that domain, which is Iris Smartring. And on the second half of the event, we will review the Future of Health grant program and announce the winners of the next cohorts. So we'll announce you the 9 selected startups for the next month. So that being said, I would like to introduce the first presenter of today, Jean-Philippe Lallemand, the director of EPFL Innovation Park. He will talk about the mission and strategic focus of EPFL, the interconnection of different programs and their links to preventive medicine. He will also highlight some of the success startups in the EPFL startup ecosystem that are offering prevention-linked technologies as role models to inspire maybe many of you today sitting in the room. Jean-Philippe, the floor is yours. And I gave you this. C'est bon.
Do I need to activate? No, fine. Thank you very much, Johannes. I thought you were going to make my pitch, but you didn't fully. Thanks. Very pleased to be here tonight. Welcome to all of you partners, founders, mentors, investors, and I guess all of the other people that are helping this community grow. Yes, I'd love, this program is very important to us, not only because of the partners we're doing it with, because it aligns very much with our new mission and new focus that I will briefly explain. We have 30 years of experience in leveraging innovation and impact, and that makes us quite unique in many ways. because, well, of course, the Innovation Park, we rely on the research from EPFL, we rely on a very extensive, a very broad research, and deep as well, with a lot of excellence. And more specifically, we have, over the years, over those 30 years, slowly shifted our mission. You know, the first mission initially was to foster entrepreneurship, to develop entrepreneurship, make sure the technology from EPFL reach the market. But nowadays, what really concerns us, what really is our main driver, is to make sure that we collectively achieve an impact. We achieve an impact by leveraging those disruptive innovations and making sure they improve society and they improve the planet. And that's what this program is all about, I guess. Prevention is part of this movement. Medicine is part of this movement. For us, there is health and life sciences in general are about 1/3 of our startups, of our activity. And it doesn't exist by itself, you know. In order to make an impact on the planet, on society, you need to have more than just life science. You need also green tech, sustainability, you need trust. These are the 3 domains we focus on, and there are clear links between the two. Take an example, of course, for health, you need also good agriculture. You need to preserve the soil, you need to preserve the water, you need to preserve everything that you use as a resource and restore it. That's why green tech is also very, very important for health and for preventive medicine. You also need trust, because you're going to rely on people that will handle your sensitive data. They will handle your health data. They will know a lot about you. You want to make sure that this aspect is well covered and that you're not going to be hacked. So all those domains are very dependent upon each other. And that's why we have developed programs that I'm not going to describe, but that are really going on strongly with many partners to make sure we develop innovative technologies in all those areas. Moving forward, we want to further increase, again, our cooperation with partners and be even more focused on specific domains. So moving from health in general to well-being, to longevity, to nutrition, again, with partners. Also working on regenerative technologies, because there's a lot that will need to be regenerated in the world in the coming years. We also want to work on net positive manufacturing, as an example. All of that, plus trust and quantum that I already briefly mentioned, are domains where it's really worth working together, developing specific focus groups, and getting to the next level, because these are not easy domains to tackle individually, and I don't think any single company can do it, or university. Moving back to preventive medicine, what I found interesting to note is that we have an evolving ecosystem. We already have a base in the region of relatively established companies, that some of them are listed here: AC Immune, Amazantis, Abionic, Domo Health, Sophia Genetics are among the companies that are well established and contribute to this preventive medicine domain. And we see and we welcome through the program some new ones like Gengnomy or Loop Medical, Safeter, Smart Cardia, a bit younger, but there are even more new ones that obviously you're going to discover that. So we have a base, but it still needs to grow quite substantially. And I like very much this description of Medicine 3.0, because life expectancy is not a given. Huh? I think you know that. You know what happened in the United States in the past few years, and we can see there is a dramatic shift down, the dramatic reduction in life expectancy that is likely due to COVID, but also to all those more systematic diseases that are taking place nowadays. And the question is whether the green bar will go up rapidly again, and catch again the blue bar, or are we going to see the blue bar stagnating and maybe going a bit down? That's the interesting question that I hope we will debate today. So again, welcome very much. I think you understand for us how important this domain is, along with the two other domains we're tackling, green tech and trust. And I wish you a very good afternoon.
Thank you, Jean-Philippe. Very interesting words. I think it's great that the Future of Health Grant has such a strong foundational partner. I now would like to welcome Bernhard Röger, the President of the Board from CSS, the second founding partner of the Future of Health Grant, on stage. He's the President of the Board. He was a member of the Board since 2013. Welcome, Bernhard.
No prompter for me, so I need to turn my pages. Dear representatives of startups, dear partners of the Future of Health Grant Program, dear experts from EPFL, dear investors, journalists, dear auditors. Let me start by thanking all of you for your attendance here in this iconic location, the Rolex Learning Center. We have come together today to celebrate an important occasion. The first year of the Digital Health Innovation Platform, the Future of Health Grant, which was launched thanks to the EPFL Innovation Park together with the CSS. As the new chair of the CSS Board of Directors, I'm delighted to share my enthusiasm for this platform with you. As you know, the values it embodies, those of innovation and entrepreneurship, are particularly dear to me. And I believe that they are values we can easily apply to the world of healthcare in order to better meet patients' needs. The advent of digital technologies is revolutionizing medicine. We are about to transition from medicine in its present form, medicine 2.0, which demonstrates its scientific excellence on a daily basis, but is focused on treating conditions that are already present, to as form a medicine which increasingly makes room for an aspect that currently remains on the margin. I am referring to the preventive medicine, this explanation you gave us before with Medicine 3.0. Contributing to the advent of the, let's say, digital medicine, that is the Future of Health Grant mission. Through this platform, we help those with the potential to develop innovative digital health solutions, to establish an efficient business model and find their clients. And the value our collaboration with EPFL, as it facilitates research and development in the field of digital health. The use of digital technology in the field of healthcare extends the potential of medicine. Thanks to data and artificial intelligence, diagnoses are becoming increasingly accurate and treatment more personalized. Giving practitioners access to the medical information they need improves the coordination of care. But in order for digital technology to fully cover its vast potential, it must be implemented with common sense. Digital tools must be designed in a simple and efficient way that makes them easy to use for every stakeholder, every insured person. This may sound obvious, but it is something that requires a great deal of attention during the initial design process. The views of all the interested parties must be taken into account if we want solutions to work that benefit to everyone. At the same time, the solution must comply with regulatory requirements, particularly where data protection is concerned, because only perfect data privacy will allow us to build the trust and confidence that is essential in the digital world. When we speak about revolution, we are also speaking about changing minds. I have been championing pioneering solutions all my life. And this is what I also want to achieve at CSS. We must learn to think differently, to be more curious, to ask questions, to interact with others, to react quickly. Innovation is not a prerogative of the research teams. It is something we can all do. And this mental agility is key to enabling CSS, together with all of you, to play a part in shaping the new healthcare landscape. In conclusion, the Future of Health Grant is a magnificent project, offers real-world solutions, promotes new interdisciplinary governance structure between actors with very different profiles, and all with the sole aim of improving the experience and well-being of patients. And I would like to thank all our partners for their expert contributions that give this project its unique collaboration character. Ladies and gentlemen, in today's interconnected world, it is only by working together that we can succeed in developing the novel solutions that will shape the tomorrow healthcare. Thank you for your attention and have a nice day.
Thank you, Mr. Bernard Rieger, for your introduction words, which sum up the CSS vision as a key insurer in the healthcare sector in Switzerland. I would like now to introduce you now the first keynote of the day, Viviane Tan. She was leading the strategy and innovation at Kaiser Permanente, and she's now Vice President managing the strategic information management and global relationships at Kaiser Permanente. In this role, Viviane provides the strategic leadership for an enterprise data and analytics team in order to support, enable, and advance Kaiser Permanente's strategy. Additionally, Viviane manages the partnerships with the World Economic Forum in collaboration with the Chief Strategy Officer on the broader international strategy. And she's going to give us her vision of how the past, with its approaches and the past pandemics, is helping us to have a clearer vision of the future regarding the medicine, with a more preventive and personalized medicine. Yeah. So Viviane, you should be on Zoom now. I see you. So whenever you want, the floor is yours.
Great. Thank you so much for that kind introduction. And it is an honor for me to address the Future of Health Grant conference and audience of innovators and change makers. I'd like to maybe start with a quick overview of Kaiser Permanente. As many of you already know, we are a fully integrated care and coverage health system. We offer comprehensive health insurance coverage, along with a full spectrum of care from hospitals, clinics, pharmacy, lab, rad, all the way to home health services as well. We are also one of the largest integrated systems in the US, with 12.7 million members, close to 40 hospitals, over 600 medical facilities, 212,000 employees, and 24,000 physicians. And last year, we had revenues of $95 billion. Maybe more importantly, Kaiser Permanente has a very strong focus on prevention and proactive care management. And we have always been early adopters of technology and continue to innovate and lead in digital health. We are also really proud to be recognized for our high quality care across many areas, including and maybe especially preventative care. Next slide, please. Awesome. From our very start, Kaiser Permanente, which we were founded over 77 years ago, our health plans, that's our insurance, part of our business, have received fully capitated payments from both commercial groups, individuals, and also government programs like Medicare that cover the elderly population in the US, along with Medicaid, which covers lower income populations. This very unique, financial incentive structure inherently highly aligns our system with really keeping people healthy and preventing illness and the progression of disease, across our populations. We have always been rooted as a value-based healthcare system where we seek to optimize care outcomes while being as efficient and effective as possible. Our value-based healthcare system is anchored in several key strengths. The first is the evidence-based care, what you refer to as medicine 2.0. Along with that is our personalized care, including genetics and genomics and organomics, which is more of your medicine 3.0. Along with that is also the recognition and the study and practice around addressing upstream social determinants of health, like broader food, housing, transportation, services, safety, and economic opportunities. The pandemic has been very challenging for many health systems, including Kaiser Permanente. But we have gained a lot of insights into consumer health behaviors and preferences, leveraging the power of big data and AI. For example, we have 4,000 machine learning models in production and 300 deep learning models. And over the course of the pandemic, we have built a very powerful digital personalization engine based on very sophisticated knowledge graph databases and technologies. As well as shifting to a lot of near and real-time NLP-driven interactions. Next slide, please. Everything we've done, including this integrated model consisting of our health plan, our hospitals, and our medical groups, this really enables and allows us to become a leader, continue to be a leader in preventative care. We had so many examples at Kaiser Permanente. I found it difficult to maybe just highlight 4 of them. And maybe in the interest of time, rather than go through each example individually, I'll touch on the common themes across these 4 examples of preventative care. The first is we really take a data-driven approach. We at Kaiser Permanente have over 20 petabytes of data and growing very quickly, including genomic information and also being one of the largest biobanks in the US. And the prediction and insights we look at are a lot of segmentation work, member and patient segmentation, and we focus on various segments, including the at-risk segments. So population segments that do not have a disease or illness or condition yet, but are at high risk of getting that condition. And we really try to apply predictive analytics and prescriptive analytics, often using artificial intelligence to predict the progression of this at-risk population, as well as prescribe proactive preventative interventions. The second key theme across all of these examples is our key concept of care without delay. We want to provide preventative care without any delay. And it is really provided through a network of coordinated care teams. We take a very strong team-based approach to our care, along with very scalable and often automated clinical workflow, enabling very, very continuous member-patient follow-up and follow-through. And finally, the last theme across all of these preventative care examples are that we are highly technology-enabled with high integration, high interoperability, and real-time data and analytics. Next slide. So maybe I would like to leave you with a thought and maybe a call to action. I know many of you are key innovators and experts in your areas. The future of health and healthcare are really in our collective hands. We take, in addition to a team-based approach, we have a very team-based, innovative ecosystem. At Kaiser Permanente, we actually have internal innovation arm, as well as KP Ventures. So we actually have our own ventures group as well. And we have a strong and long-standing partnership with many internal and external innovators across both the public sector and private sector. So when we take a common collective approach, we can really change and innovate the future of healthcare. And I am very excited to have had some time today with you to walk through our approach to what you're calling medicine 3.0. And we also wish you the greatest success, both today at your conference, demo, and into the future. Thank you so much, and thank you for having me.
Thank you, Vivienne. It was great to have you. It was inspiring to see how you're already working on implementing Medicine 3.0. We are very grateful that you found the time to share your thoughts today with us. And I believe it's in the morning in the US, so thank you again, and we wish you a great day.
Thank you so much. Take care.
Okay, so now after we've heard examples from overseas, I think it will be very interesting to hear what experts from Switzerland will have to say about Medicine 3.0. And it's a special honor for me to introduce our next keynote speaker, Professor Elgar Fleisch, because 4 years ago, I finished my PhD at his chair at ETH. Professor Fleisch is Professor of Information and Technology Management at ETH Zurich and at the University of St. Gallen. And with his largest research group, the Center for Digital Health Interventions, he investigates the impact that new technologies have on our healthcare systems. He's not only an academic, he's also an entrepreneur and co-founder of several startup and spin-off companies, and he's also an author, and he has summarized his thoughts on health and technology in his latest book, The Digital Pill. Please welcome Professor Elgar Fleisch.
Okay, So thank you very much for inviting me to this wonderful place. Actually, I have no clue how you guys can work with the lake here in the back. It's just fantastic here. It's an honor to be here. And so please, what you hear right now is an engineer's view, right? So some practitioners really hate that a bit. So I just want to talk a little bit about why prevention is really important with Swiss numbers, very briefly, and then why it's not working today, maybe a little bit provocative, and then how we can fix it. So the first driver, okay, that's how it works. The first driver is that's the first driver why we need prevention is that we have this pandemic of chronic diseases. Just very briefly, well, the medicine we developed in the recent 100 years was just fantastic. Life expectancy increases. People don't die anymore of infectious diseases. However, what you see is that we have really an aging population. This is more or less true across the Western world. So from a slim arrowhead, we really move toward a kind of fat inverse pyramid. Here you see my age, and if you move myself for 25 years ahead, oops, that didn't work. Anyway, if you just move that thing 30 years into the future, and I should become or get 55 or 85, then you will see that in Switzerland, 30 years from now, you have 2.5 or even more million people above 65. So this is not just Switzerland, but this is across the globe. So, and when you get older, then you develop in the Western world chronic diseases. And just as an example, you see the prevalence of diabetes developing along with GDP in China. This is also true for Mexico, for basically any other country. So every second inhabitant of China these days has an elevated blood sugar level. So, and this is true for all chronic diseases, for all regions. So we live longer. However, this life expectancy it increases. But what you see on the right-hand side is that we live way longer with disabilities. So this is this JLD means years lost to disabilities. That increases dramatically. We get older, but we lose life quality. 80% of these years lost to disability come from NCDs, from chronic diseases. So this is a huge toll on all individuals, but also all families who have to take care and society. So that's why these chronic diseases account even today for 85% of all healthcare costs across the globe, because you are not sick just for 2 weeks or 2 months, but you usually are sick for the rest of your life. So the healthcare costs explode in the US. Despite we have Kaiser Permanente, which is really a fantastic showcase, it accounts already for about 18% of GDP, which is incredible. So also in Switzerland, these numbers look a bit insane, and just look at the outlook for your health insurance rates. So why is this the case? As said already, we developed a wonderful healthcare system in 1900, and that's the system we still have today in place. And in 1900, the leading cause of mortality has been acute diseases. So that's the left-hand side. On the right-hand side, you see what we have 2010. The leading causes of mortality is chronic diseases. And these systems are just not fit for it. It's completely different disease patterns. So the healthcare system was so successful in the old world, but it's not successful in the new world. Then we have a next driver, which shows us where the future probably goes, where the evolution will come, and the evolution probably is the strongest force we have here on this globe. It's technology, especially digital technology. we want to look at one dimension briefly. So how did the internet change retail, change banking, change traveling, change education? Well, it shifts tasks upstreams to consumers, from companies to consumers. So it increases autonomy, and it generates lots of actionable data. And that is also true for healthcare. Just let me give you a few examples that show what I mean. About 60 to 80% of the average German-speaking person seeks advice before he or she visits the doctor to Dr. Google. Of course, then also develops hypochondria. Many of you start using free trial tools, triage tools, to see whether I'm really sick or not. Some of you who are really sick look for help from other expert patients and platforms like Patients Like Me. This shows us that privacy is only something for privileged, healthy people. If you're really sick, you don't care about privacy, you care about help. Then we have this time series data that measures the help for the first time on a timeline. And many of you start doing that for your own benefit, but maybe in the future also for the benefit for society. Then we expand the lessons we have from pregnancy tests to other fields. So we start testing ourselves. We are deep coupling consultation, examination, and data generation with every new test that develops also at EPFL. Then we have citizen scientists who happily generate and share new data despite all this privacy talking. Now, let me sum up. So these are the two streams that move towards prevention. However, as of today, only about 3% of healthcare spending flows into primary prevention, 3%, which is nothing. Why? Well, that's what I want to show you on the next 2 or so slides. First of all, what is prevention? There is these 3 stages of prevention. When we talk about prevention, we usually mean prevention, the primary prevention. That means you are not sick and you want to prevent from getting sick. Then there is secondary prevention. That is to detect, if you're a risky person, to detect very early on and treat your disease in an early stage. And tertiary prevention, that's when you're really already sick and you take care of not getting way sicker. Now, different studies have shown that there is a big discussion going on, but that about 25% of the chronic diseases are bound to the genes. So in 25% of all the cases, well, it's luck or not. But in 75% of the cases, it's choice of lifestyle. That's crazy. So we could prevent. That's the first message. So it would be able to prevent way, way more than we think. And this is also true in other industries. Look at, for instance, industry as in the maintenance of cars, the maintenance of planes, the maintenance of trains. Here we do prevention like a Swiss watch, like a Rolex, right? It's planned. We have budgets for it. We know how to do it, but not with our bodies. So prevention it doesn't work. You have many reasons why, what could be the difference. So we do constant measurements in cars. And then there is this alarm things going off if the oil pressure is too high or water pressure or water temperature is too high. So we have warnings. The checks are mandatory by law. We assign personal budgets for cars, but not for ourselves somehow. But there is maybe deeper reasons why prevention doesn't work. And we just went through all the players in the market. And the basic reason, you see it always in the last line, it's not a business case. Now let me just sketch it out for the payers, and I really leave out CSS because that's a wonderful company. but maybe for some of the others, it's true. So if you are a payer, health insurance, well, and if you know an Excel sheet very well, then you know less damage means smaller insurance bill means less revenues. But that's pure logic, right? But you can work around it with good tricks. But anyway, or individual pricing means, so if you pick out the best risks, means smaller bills, means less profits. If you have good people on the risk side, they say, yes, 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 prevention is cool, but you cannot isolate the effects of prevention on the long run. So you cannot calculate it. That's also true. You have unknown and potential high costs on the reimbursement list, like if you do a DIGA in Germany, right? Insurance companies hate it, and I understand exactly why. So then you have strange regulations that forbid you partly to do prevention. At the end, you have no business case. So, and this is true for basically all players in the field. Right? So it's kind of a deadlock. This is true for healthcare providers. You find the arguments, even for scientists. Why for scientists? Because if you do a prevention study, there is so many factors going into that dependent in deciding how the dependent variable will evolve, so you don't do a scientific study because you cannot publish it very well. So that's why you don't find research in it. So basically the system is kind of broke. So anyway, now that was kind of the critical part, but how can we now go about it, think about it? And I would, that's the high scale, the University of St. Gallen part of me. Well, you have to turn it into a business. If somebody can make money out of it, feed his or her children, then it will grow, then it will spread across the globe. Now, so what would we have to do? Let's look now at the following sketches. So today, how do we do treatment of people today? First of all, we wait until you see clinical signs. Then you start measuring, like temperature or something like that. So you start measuring yourself once you are sick, and then you start managing. Why do you do that like that? Because then you have a reason to go to the doctor, and you have a reason to hand in the bill at the doctor, at the insurance company. So that's how the system works today. Preventive medicine would be that you measure all the time. And then if you see something goes wrong or might go wrong, you already start taking action. Now, it's completely understandable if it's very expensive to measure, and if it's unclear how to respond to that measurement, that's also expensive. It just cannot be done. Right? There is no cost-benefit relationship that would work out. So what we, at the end, are looking for is the following. So this being healthy is a black hole. We don't know exactly where we are on this line. We only know when we get sick, something is wrong. So you start measuring and entering the system once you are sick. So what we want to do is we want to put light into this kind of black box and say, okay, where are we on this curve from really very healthy towards not so healthy anymore? What we are looking for is that we find accountable measurements that are low cost. And then we find accountable health interventions that would show, okay, I'm going back to normal. And this is kind of the core thing we as researchers and entrepreneurs have to look at. Otherwise, we just beg and hope. So we go for accountable measurements and interventions, and of course, accountable personalized interventions. So this is not completely weird. There is already first companies starting doing so. The first one I came across is already a few years ago. It's not exactly the same. It's really costly to make the measurement, but it's called Inside Tracker in the Boston area. So what you can do there, you can draw your own blood, or somebody does it for you, and you make the blood biomarkers, and then you upload them, and then this company makes science-based nutrition recommendations based on their own algorithm. This is only a small part, but actually it's a pretty cool part. So you have a timeline of your measurements. Still, the measuring is more expensive than you can do every day, but for health freaks across the world, this is the platform to go as of today. And suddenly, they learn from their data what really works for whom. Then there is other companies like the Swiss company Care from Winterthur, where you buy a subscription, and then you make 2 measurements a day, not just a year, not just blood-based, but you can measure lots of stuff. And then you have these behavioral coaches who help you really change your life. And both of these companies are growing. Nothing is paid from us, there is no subsidies as of now. So I think for the young entrepreneurs, this switch from 2.0 to 3.0, as some claim, but there is ideas out there is business models out there. We urgently need all the brains here, of course. Now, let me come to the last point quickly. So this prevention only works when the benefits of prevention are larger than the costs. But not for society, but really for a balance sheet. It doesn't help, if somebody profits, another party loses too much. So it should be beneficial within one balance sheet, at least within patient, within insurer, within a caregiver, because they need to still make money or survive. So one very important aspect is that we need constant measurements that are low cost and really scalable. So how do I measure my health status when I'm healthy at very low cost? I just bring up 2 examples. They might just inspire. So one was like, the question was, can we detect in a very scalable way if someone's asthma condition is getting worse or getting better? So we talked to doctors, and they said, well, if you could count how often a patient would cough during the night, that would be interesting. So you cannot count that as a human being, but if you have a phone that listens to it, if you have a machine learning algorithm on it that starts separating counts from dogs barking or from other things, then you suddenly can develop a very interesting digital biomarker. This sounds simple from a technical point of view. Sorry, this sounds simple from a technical point of view. It's not that simple. So it led over many experiments, finally, and I think it was also CSS backed, which I'm very proud of course, to a company called Resmonics. It's a startup company. You can go through all the disease patterns that are of chronic, that are important. Another startup we supported in the early days was, they had the question, can we detect mild cognitive impairments with very simple tests without brain scans? So if you can detect mild cognitive impairments, then you're on the highway to detect early Alzheimer's or any other form of dementia or Parkinson or stuff like that. So that's a long march. But finally, in 2001, this tool, which is with the company Altoida, a spin-off, received the FDA breakthrough device designation. We are not there yet, but this is another example where research could, in a medical field, in the field of digital biomarker, could contribute to changing the world for the good. I'm now summarizing what I tried to say. So I think we are really on the verge to a new epoch in healthcare towards this medicine 3.0. I would say it's kind of evidence-based, personalized prevention. And I think we only can be successful if we find business models around it. So it's the tech people, the business people, the medical people really have to work together. And I really want to congratulate CSS and EPFL for this fantastic venue and venture you're putting here together. And I hope that many of the students and entrepreneurs are going down that road and design the future system of our healthcare. Thank you so much.
Thank you so much, Professor Fleisch, for the presentation. And you put to the importance of measurement for early detection, and that's a good transition for the startup later, iris mattering. But before, we'll have the panel discussion moderated by Nicolas Loyot, who is an innovation catalyst at CSS. So yeah, Nicolas, welcome on stage, and I'll let you the lead.
Thank you, Johannes. Thank you, Dr. Fleisch. Yeah, we go down a little bit down to earth from the very big vision of the Medicine 3.0 to what can we do in Switzerland. And to talk about that, I would like to invite 4 key people in the healthcare system here in Switzerland to ask them a few questions. And the first of them is Filomena Colatrella. She is the CEO. Please, Filomena, join and sit. She's of course the CEO of CSS since 2016, if I'm not wrong. But of course, you were in the company before. And yeah, my second guest here is Diego Braguglia, who is partner at VI Partner. VI Partner is the leading investment company in Switzerland, especially in the healthcare system. Diego is not a stranger to the domain because he has 2 PhDs, if I'm not wrong. One is molecular biology, and the other one, I'm forgetting. Just one. Oh, okay, so that's good. My next guest is Jean-Daniel Lafeuille, who is the CEO of Vaudoise Assurance. So Monsieur Lafeuille has been in the insurance for all his career, I think, since 1989, out of the UNIL, I think, if I'm well, okay. And we will discuss about what Vaudoise is doing in the healthcare system. That's interesting as well. And my last guest is Dr. Schaller. Dr. Schaller is a doctor by training since 1981. He was the founder of the Groupe Donnet in Geneva. If you want to sit over there, yeah, thank you. In 1988, and what is more important for us today is the head of the Réseau Delta. So Réseau Delta is the largest GP or doctor network in Switzerland with more than 900 doctors, mostly or all in Normandy, but it's making it the biggest network. And 250,000, maybe probably more, 250,000 insured people in your network. So it's quite huge. So it's interesting to understand what is your vision of the ground of the Medicine 3.0. But first, I would like to ask the first question to Monsieur Lafeuille. What is La Vaudoise doing in the health industry? Well, what is your approach and what do you do? Please take microphones. I forgot to mention that, of course. Yeah.
Yes, it's working. Thank you. Hello, everybody. Thank you. We are not a health insurer, so no problem with my colleagues, Filomena. We have no conflict.
You're not in the same domain, yeah.
No, we was part of Intras, and we sell Intras to CSS, so it's okay. We are part of Intras, not all the Intras. So Vaudoise, we are very active also in insurance business, in non-life business, and we are active also in income, loss income for corporate customers. And that's why we are active also in insurance business, in health. And we have also services, which is called corporate health services, where we are doing prevention, absence management, and so on. So I would like to say hello to Isabel Kunze. You can say like that. It's our entrepreneurship manager of corporate health services of Vaudoise. So that's a first point. Second one, of course, as an employers, we are doing a lot, of course, on prevention. I don't think we are on level 3.0, but we are doing something on that. As Dr. Fleisch said before, we are doing a lot of things because we have to measure things. So, of course, we have employer satisfaction for our employees. That's a first point, very important point. We have the label Great Place to Work. We have it for a few months. We measure also all the absence of people. That's the basis of prevention. And then we are doing a lot of things on prevention. For example, I can tell you we have a lot of club for sport, for culture. Unfortunately, the first one, the best one is wine club. But it's good for health after 40. Yeah. I've heard that. But the second and third one are running and biking, so it's very important. Then we have internally a lot of things we are doing, a lot of work about also burnout conference, everything like that, because we found it's very important that our managers are aware about how you can see your employees. And that's very important also for our side. So that kind of example of what we are doing on prevention. Then we are doing a lot of management. We have management and support when we have problems. Some people have problems like burnout or harassment or something like that. And we are also we have trusted office mentors, which are external of the companies, to do a support to our employees in that sense.
Okay, thank you. Philomena, I have a question for you. Sorry, first I need to make a warning. I have some people I'm calling by their first name, like Philomena and Diego, and some others with a title like Dr. Chaleur, Jean-Daniel. No, okay, sorry about this. Philomena, what is you are not a competition to Vaudoise, of course. We discussed that, not really.
Depends.
Yeah. Well, what is your approach of medicine 3.0? What does it ring for you in terms of prevention? Dr. Fleisch, Professor Fleisch mentioned the fact that it's all related to a business model. Where do we go for the health insurance with this medicine 3.0?
Well, first of all, thank you very much to all partners and to EPFL for doing this partnership, this important partnership. Thank you also to the startups who are here and without whom this platform would not be possible. So thank you very much. I'm really happy about that. Then prevention is a topic that really, is important for me, but also for the company. And we started to position CSS as a health partner. And why did we do that? Because we think that the whole cycle of care is important, and that we want to have a role on the whole cycle of care. And it starts really with the primary prevention on the first phase of a life cycle. And of course, we offer our customers things like different platforms for prevention and health promotion, such as Enjoy 365, Active 365, where the threshold for doing exercise is very low, so it's accessible for everybody. And on the middle phases, becoming sane or living with an illness, we just engage in secondary, above all, tertiary prevention. But we have to say that all these activities are done above all in the complementary sector. And why that? Professor Fleisch is right when he says we have to measure our health status, and we have to find a business model around that. I agree, but the topic is that we don't have any legal basis as a health insurance company to do prevention. Just one example. We did generic mailings till the last year. So when we saw that one of our patients or insurance people or policyholder took a medicine or a drug, we could just give him a recommendation on the generic. Today, we can't do it because of the privacy law of GDPR. And so we really are not allowed to do more in that sector. That's why we support a lot the parliamentary proposal that is now discussed in the parliament, where we could do in certain specific sectors more than we do today in the primary prevention. So prevention is at the core of our vision, at the core of our strategy, and we work on that, and that's the vision that CSS has. So, but it's right that we have to find the right business model.
Is your vision that the people don't go to the doctor, to the hospital anymore? That's the paradise?
You know, my vision was in 2017 that our agencies and care, it was a little bit my vision, that our agencies, we have 100 agencies all over the Switzerland, that you enter the agency, you have this kind of measurement, then you get the plan, and our people in the agencies would just work with that plan with our people. That was really a vision, but we didn't realize it, but now CARE realized it. I know CARE because I did also this measurement. And I think it goes hand in hand, prevention it goes hand in hand in being aware of how I feel, how I take charge of my health status. And I don't think it avoids going to the doctor, but it gives you the opportunity to have a different management on your health status, but it doesn't avoid completely the doctor.
Yeah.
But it gives you the opportunity to work with the doctor on a better path, on a better patient journey, such as the Réseau Delta does with us and with other companies.
Yeah. Dr. Schaller, what is your view from the field? I mean, you are the most grounded in terms of what's happening in change, what is possible, what the doctors are doing on the field. What do you think? What do you see? And you can reply in French if you feel more comfortable.
I'm answer in French. It's be easier for me. Oui, bien entendu, le médecin de généraliste qui est en première ligne avec son patient est une pièce maîtresse de la prévention et de la médecine 3.0. Le problème que nous avons aujourd'hui, c'est que le système de santé n'est pas prêt à effectuer, à faire de la prévention. On le sait, on l'a dit, 3% pour la prévention, c'est peu. Ça, c'est la première chose. La deuxième chose, on n'a pas une politique vis-à-vis de la santé. On a une politique sur les soins. Et on voit bien qu'aujourd'hui, nous allons dans le mur et la discussion sur les primes, c'est un des résultats. Donc, et ensuite, la société continue, l'agroalimentaire continue à investir sur des produits sucrés, sur des produits salés. Ensuite, vous avez en face de vous des patients qui savent, ils comprennent qu'ils sont obèses, qu'ils ne font pas d'exercice, ils connaissent, ils savent qu'ils ont un diabète, ou potentiellement un diabète, une hypertension, et ils savent aussi qu'ils vont tomber malades. Le problème, ce n'est pas seulement de savoir, c'est comment on change son comportement. Et c'est vrai, comme on l'a vu tout à l'heure, les outils que nous aurons à portée de main, et c'est magnifique ce qu'ont fait les étudiants, et ce travail d'innovation est très important. Mais c'est comment on implante l'innovation dans un système de santé. Puis la deuxième question, c'est est-ce que les patients, est-ce que les malades sont sensibles à ces innovations et vont changer leur comportement? Et est-ce que les médecins, ils sont formés à l'éducation thérapeutique, mais est-ce que les médecins demain peuvent être financés pour accompagner les patients à changer de comportement? C'est des questions vraiment ouvertes. L'innovation est intéressante et on pourra continuer à discuter sur qu'est-ce qu'on devrait faire ou qu'est-ce qu'on pourrait faire. Parce que les incitatifs vont dans le mauvais sens aujourd'hui. Tous les incitatifs en Suisse vont dans le mauvais sens.
As the biggest or the largest network of doctors in Switzerland, do you integrate innovation? Do you have some seminars where you train the doctors, where you...
Bien sûr, depuis 30 ans, nous faisons de l'innovation. Nous sommes allés au Kaiser il y a 30 ans. Et on ressort aujourd'hui le Kaiser. Chaque 10 ans, on sort le Kaiser et on dit voilà un modèle formidable. Mais oui, il est formidable. Mais il faut comprendre pourquoi il est formidable. Quels sont les ingrédients que nous n'avons pas en Suisse? Tant qu'on n'a pas ces ingrédients, dans un modèle de financement, dans une philosophie, on ne changera rien. D'accord. Réseau Delta, aujourd'hui, il fait ce qu'il peut. Il faut le savoir que nous sommes un réseau de médecins de famille qui sont dans leur cabinet. Nous faisons de la formation pour ces médecins. Les médecins sont tous suivis des cours d'éducation thérapeutique. Les patients sont aussi informés par les assurances, comme vient de dire Mme Collatrella. Et nous avons des datas. Nous avons des datas, mais nous avons de moins en moins de datas. Parce qu'aujourd'hui, les assureurs ne nous les donnent plus. D'ailleurs, la CSS est la première assurance, malheureusement, qui ne nous donne plus les datas. Mais pas par votre faute. Non, mais pas par votre faute, à cause de la protection des données.
Et
de la complexité.
C'est ce que je disais avant.
C'est ce que vous avez dit, Mme Collatrella. Donc on a effectivement une difficulté, c'est que tout le monde dit on veut des datas, mais aujourd'hui on ne peut pas collecter les datas. Si vous n'avez pas des datas pour piloter, pour pouvoir accompagner des patients et donner des informations, comme on l'a vu tout à l'heure avec le professeur Fleisch, on ne peut pas transmettre des informations valides sur pour essayer de modifier les itinéraires cliniques, enfin modifier les styles de vie de nos assurés et de nos patients.
Okay, thank you. Diego, you are an important piece of the ecosystem because you bring the money that the innovators are looking for, not to everyone, to a few selected best startups. What is your vision of the medicine 3.0, this use of the data prevention? Is it one of the focus of VI Partners?
It is a very important focus, but let me just to start we have to realize, to understand and accept that life is a sexually transmitted deadly disease.
Yeah,
this is what true. Is it. So we can do everything we want, sooner or later we are going to die. Now, I think the goal is just to add life to the years, not years to the life.
Yeah.
And what we're working now, and I think we have looked, it was a very nice presentation in Tervenance to say the importance of prevention. This is very important. The issue is nobody is ready to pay for that prevention. Nobody is there to pay if you have a startup setting up some preventive tools or rehabilitation tools, which I think we are very close. Nobody is willing to pay for that.
So in your world, we say we don't have the business model, right?
We don't have a business model. We don't have now the acquirers who are ready to commit to buy for people, for companies who are really very strong in preventive medicines. Just a very stupid example. It was a study committed 15 years ago. They said that in the US, you have an elevator starting at the 3rd floor, not at the ground floor. Just in that, you may have a decrease in hypertension by about 15%. Just that. Nobody's going to pay for that.
Yeah.
Nobody. So I think I would like just to take away the discussion just for a highly political debate, especially here in Switzerland. I think the insurance prices has been already released, the new prices for 2024 or not? How much for health insurance is next year? Do we already know how much more we have to pay?
Tomorrow. Well, for
it's 2024.
Tomorrow. We know it tomorrow.
Okay,
but I've seen before that some...
I
think well tried, but
we are going
only
to
tomorrow.
I can't say anything, so otherwise Bear says...
Being here an institutional investor, I think we have a fiduciary duty to make money with the investor who just gave us money. And I think being in that very, very important field of preventive rehabilitation medicine, there is really no market. There is no market.
Yeah. So there is the business model which is impeached or blocked by the law somehow, but wouldn't be the solution to create some pilots together, and these pilots we prove to the BAG or FSP that something is working. do you think, Philomena, it's a way to go? I think I'm just asking the question because you have a pilot together.
I would have referred to that pilot.
Exactly.
We have a pilot together.
Do you want to say something?
With the Dr. En français?
In English.
In English, okay.
Yeah.
No, we have a pilot. We just have this pilot. We launched the pilot together with Réseau Delta.
What is this pilot into?
Well, the pilot consists in integrating different actors, health players, such as doctor, physicians, such as home care institutions, such as hospitals, and I think the main objective is to find, the monetization system to eliminate the wrong incentives. Yeah, I think that's the main issue of these pilots. How do we find the full capitation model to be really effective and to have some kind of Kaiser Permanente Kaiser Permanente effects without a financing model which considers the whole patient journey and the activities, on the different touch points on the patient journey. The integrated care model has no sense. So if it's fragmented and you have a full capitation, so it's very difficult to get through. So we presented the pilot to the Federal Office of Public Health, and we hope that we can make some pressure on that. Otherwise, we do it anyway. We try to do it anyway.
Je crois que pour replacer la discussion sur le projet pilote, comme vous le savez, en Suisse, depuis à peu près 20 ans, il y a eu 64 motions et propositions de changement de la LAMAL au Parlement. Aucune n'a passé. Fort de ceci, M. Berset a nommé un groupe de 15 experts qui ont travaillé, 15 experts suisses et internationaux, qui ont travaillé pour essayer de trouver des solutions par rapport à la problématique du coût de la santé, de l'augmentation des coûts de la santé en Suisse. Parmi ces propositions, plusieurs propositions ont déjà passé la rampe, c'est-à-dire le contrôle des factures, la transparence, le prix des médicaments. Et puis, pour essayer de changer quelque chose au niveau de la LAMAL, il a été proposé d'introduire dans la LAMAL l'article 59B, qui est un article pour et en faveur de projets pilotes. Donc tout acteur du système de santé, assureur, prestataire, canton, peuvent déposer un projet pilote à l'OFSP avec de l'innovation. Si ce projet est accepté par l'OFSP, une ordonnance sera édictée et puis ce projet pilote pourra effectuer ces transformations pendant 3 ans. Il sera évalué et ce qui est très intéressant, c'est que si l'évaluation est bonne, il sera directement intégré dans la loi sans nouvelle votation. Donc, comme l'a dit Mme Colatrella, ce projet, c'est un projet qui nous permettrait enfin d'avoir un budget global et de pouvoir fonctionner comme nous l'a montré la personne représentante du Kaiser, et surtout revoir les incitatifs et financer les médecins de premier recours selon une autre modalité, sur la plus-value qu'ils apportent, sur l'efficience par rapport à un budget qui est alloué à une organisation ou de manière à pouvoir comparer un patient qui est dans le système et un patient qui est hors de système. Je pense que c'est la seule possibilité d'avancer rapidement dans ce pays pour transformer le système et pouvoir implanter les innovations, des innovations disruptives. Tout le monde aura un intérêt d'améliorer la santé de la population, les santé individuelles, parce que nous alignons en fait les incitatifs.
Yeah, I think we all share this vision. We are here to talk about innovation. Did you involve some startups in this pilot, or it was not necessary, or you wanted to secure first the pilot with the people were established like Clinique or Hôpital de Morges, people like this? Or are you ready to bring some startup with new innovation into this kind of pilot?
Oui, je pense qu'il y a beaucoup d'innovations qui peuvent être implantées. Bon, ce qui est important, c'est de dire au départ, il faut une innovation organisationnelle. Je pense qu'il nous manque aujourd'hui, c'est de l'innovation organisationnelle, c'est du partenariat entre les différents partenaires. Nous avons la chance, effectivement, de travailler notamment avec la CSS, surtout depuis un peu plus de 30 ans, enfin 30 ans avec le réseau Delta, ça a toujours bien fonctionné et on sait que c'est des partenaires avec qui nous pouvons faire un bout de chemin. Ce qui est difficile, c'est effectivement qu'il faut, le pilote sera local, la CSS pense stratégie aussi nationale, donc c'est bien dans le cadre du pilote. C'est un gros effort pour la CSS de se lancer dans ce pilote, parce qu'elle doit aussi mettre des efforts, mais je pense que ça vaut la peine. On a vu aujourd'hui, et vous l'avez entendu dans l'interview de Mme Butikofer hier, les hôpitaux aussi disent on ne peut plus, on n'arrive plus, il n'y a plus d'argent, donc il faut innover. Et puis Swiss Medical Network a pris aussi les devants avec Visana. C'est un peu un projet identique. Il travaille avec la loi actuelle. Nous allons un peu plus loin que Swiss Medical Network dans ce projet de partenariat avec le canton aussi, canton de Genève, canton de Vaud, les assurances.
Yeah, excellent. Diego, on your side as an investor, do you think if you have a startup we would be belonging to this kind of pilot things, would it bring something on their deck for investment? Do you think it's demonstrating the traction for the startup? Is it something which is valuable that you would estimate more for the startup? Or you didn't think about it?
Of course, we look at it with attention, and especially we are all exposed to that. And I think prevention and being part of that module is definitely a very important element. But what needs also to be considered is the so-called exit routes, also who is going to buy that startup. And this is where we very much struggling to find a solution. So there are many, many startups working on, there are very good preventive tools where you can measure, you can quantify, you can reproduce, but when you're coming to the fact how you can make the health economics out of, let's say a simple example, how to prevent or just to decrease hypertension. How you can say a decrease of, 10 points of millimeter of mercury in your hypertension, how much money you're saving. I think Philomena, you certainly know. But I think who is going to pay for that? If you have a startup developing that algorithm, who is going to buy that startup? And this is where, as an institutional investor, we don't find a solution there. It's not because the asset, it's not because the methodology, it's not because the needs are not there. It's just because we are missing who is going to be the end buyer.
Okay, but you invest. You're raising a fund. I don't know if you're allowed to say that, but you invest. What are the segments that you invest in? If we talk about the Medicine 3.0 or healthcare.
Also, we are raising now a fund which is full in Medicine 3.0, and one of the main topic of this are new business model on B2B. B2B. Okay. This is, which might be interesting for the pharma, might be interesting for the distributors, might be interesting for the regulators, might be interesting for the insurances.
Okay, so B2B in opposition to the B2 patients, B2P.
I think B2U, which is business to usual.
B2us, yeah.
But I think definitely, you can have very useful app to measure your blood pressure, to measure your glycemia, but those are just tools. I think down the road, I think the médecin de proximité is the main player in that scope. But what we are, and this is, nobody's going to pay for that. I think we are interested to invest in company who really, you make the access to new drugs, to new therapeutics, to new business model much more efficient.
Yeah. Okay, thank you. Jean-Daniel, I would like to end with the last question to you. Do you think that finally the move would come from the companies, from the corporates? Maybe if they take the lead to launch prevention programs for their collaborators, would it come from this side? I mean, to demonstrate what is the prevention medicine 3.0, would it be an avenue for pushing this topic?
Yes, of course. I think it's good to put the things from corporate point of view. Nevertheless, it's not enough. I think what it was told before is very important. I agree absolutely with Mr. Schaller and Philomena. It's very important to write more than that. But nevertheless, corporate is very important because there is also, you see, we are in a particular society today where the mental health is difficult. It's very difficult. When you open the newspaper, not physically, not digital now, it's always bad news. You're always at bad news. So at the end, it influences also the mentality of people working in corporate. And that's why we think that with our corporate health services, the goal is to push prevention, to speak with HR department, to tell to HR department is so important to emphasize the fact that if the mental health is good, then the physical health will be good also. So I think we have a lot to do on that sense, and we are doing a lot with some prevention effect on that side.
Yeah, so something which is important for those who were not here last year for the launch of the program is why do we have Vaudoise participating to this Future of Health grant program? Is because you asked us, please source or find or identify solutions in the mental health domain, because for Vaudoise is quite a strong direction, and I guess for the collaborators of Vaudoise, but of course, not only, of course, but mostly for your
of premium in health insurance.
Exactly.
It's very important, not only for us, but all the corporate companies that are in Switzerland.
Yeah. Thank you. I would like to thank you four of you. We only scratch the topic right now, but we have the opportunity at the apéro to exchange a little bit more. And what we want to do at the Future of Health grant is to start conversations. So that's this is the objective, that the people know each other. Start thinking about some disruptive idea, and that we try to move things with ideally some pilots together. Thank you.
Again.
Mike.
Okay. Thank you, Nicolas, for the discussion, for the moderation, and thank you for the panelists. Sorry. What I would like to do right now is I see many people moving, so I suggest that we do 2-minute break, but when I say break, don't go too far because it's just 2 minutes. So what you can do is just stand up, stretch a bit, and talk to your neighbor for 2 minutes so that it can give you some freshness, and then we start again in 2 minutes. So don't go too far, please. I see people moving already. Don't go too far, but you can stand up and discuss with your neighbor for 2 minutes.